I want to say, Onesimus, maybe, or Karimi, you can check with Nicole to see if she's going to jump in as well, just to make sure. You might want to send her a text or something. Nicole Thompson, I think she was going to join us tonight. She might have got cold feet. So we are in the show. I want to thank everybody for joining us tonight. I'm Clee Jackson, president of the Greater Grand Rapids NAACP, and we are super excited to have another community conversation with just real everyday community folks who have to make a decision, like we all have to, whether or not we want to get vaccinated. And so wanted to speak with them tonight about if they are vaccinated, what prompted that decision, how do they feel after getting the vaccine, and which of the two vaccines, the Moderna or the Pfizer, that they've received. We also know that now Johnson & Johnson has just received what's called an EUA, emergency use authorization, from the FDA, and will start, actually, I believe, next week, distributing their vaccine, which is interesting because it's a one dose vaccine. And I always have to say, even with the one dose, and there have been guests have been on the show where we talked about the efficacy of the Johnson & Johnson vaccine versus the efficacy of the Moderna and the Pfizer vaccination. And as we know, the Johnson & Johnson at this point has about a 66% efficacy rate. Some of the experts will say, don't focus on that. It's not important. The efficacy rate is not important. People just need to get the vaccine. But I actually think it's critically important to focus on that because of the healthcare disparities that have existed, not only in the Black community, but other communities of color. And so we have to be very transparent with the information especially that we're giving our community. And so I think it's important just to lift up all facts around these vaccines. So I want the guests to introduce themselves tonight. Again, I want to personally thank you all for joining us, and just give us a brief introduction of yourselves. We're going to start off with ladies first. So Mrs. Veronica Lake is up to bat.
Well, good evening, everybody. Hope everybody's doing well. I am Veronica Lake. I am the principal of River City Scholars Charter Academy here in Grand Rapids. I'm also a wife, a mother, grandmother, aunt, uncle. No, not an uncle, aunt. An aunt, cousin, all of that good stuff. So it's a pleasure to be here with you.
Thank you. Mr. Willis.
Good evening, everyone. I'm Stacy Willis, and I currently serve as a business analyst at Mary Free Bed Hospital. I also work as a COVID-19 community connector through the Kent County Health Department in collaboration with the Black Impact Collaborative. I am a husband, a father, and all those good things, and I'm glad to be here with you all tonight.
All right. Thank you, Brother Willis. Mr. Eisen.
Good evening. Thank you for having me. My name is Leonard Eisen. I'm currently on the board of the NAACP. I'm a friend, I'm a father, I'm a husband, and just a good overall person.
All right. Thank you, Brother Eisen. Good to have you here. I'm sure you have a lot to say this evening. And President Jayvon Fields.
Well, good evening, everyone. My name is Jayvon Fields. I'm the president of the Greater Grand Rapids NAACP Youth Council. I'm super excited to be on this panel tonight. Give youth perspective of the COVID-19 vaccine. I'm a brother, I'm a son, and I'm somebody's friend. So, yeah. Yeah.
Thank you, sir. So let's just jump right on into it. We've shared, and I would invite all of you, if you have not seen the past live streams on this series, to go back and view those live streams, because there was I think a wealth of information, a wealth of knowledge that was translated to community, and it's just again, like I said earlier, very important to make sure we're staying current on this topic, because this has been one of the most devastating things that has happened not only to this country but the world. I would have never thought that if someone would have told me a year ago, 2 years, or I should say 2 years ago, leading up to this pandemic, that the whole world would be shut down and it would be this what I actually refer to as a pestilence. Um, uh, I would not have believed them. I just would not have believed them. And and quite honestly, in March of last year, this time we were traveling, a group of us, and we were in Atlanta, and that's when it became real to us, because we were at the point that they were discussed. There was some discussion around them shutting the airport down, and so when we were actually about to leave the city to get back to Michigan, and then while we were down there, people were out, but there were um, you could see that people were staying in, businesses, there weren't as many people in, and so it was disturbing. And so, and then we went into this horrific pandemic that has taken the lives of over 500,000 people. It has disproportionately impacted Black and Brown folks, and not only with, when you look at the death rates, but also just the positivity rates across the board. And so, want to have a real conversation with you all tonight, about the impact that this has had on you personally, the impact that it's had on your, people that colleagues, friends, family. And so I want to have you all speak a little bit about that, because you guys are real faces, right? And I think oftentimes that story isn't told enough, and this whole wearing a mask thing has been, politicized, it's been weaponized, and I know the experts had said, I want to say it was this week, and or it was last week, so President Biden has this whole team that's focused on this pandemic, and I believe it might have been Dr. Fauci or one of the doctors, or it could have been the sister from CDC. But anyway, one of them had said, so they were asked a question about if we would have just followed what we were asked to do, would we be essentially, where would we be? Would we be better off? And they said, if we would have just followed everyone wearing masks, in social distancing, the number of deaths would not be where they are today.
I think,
and so, hey, Gail, welcome.
Well, anyway, I heard it was like 40% of the deaths could have been prevented if we had did what we were supposed to do, wearing the mask and mitigate.
Right, absolutely.
So that's out of how many people is it now? Is it 500,000? So
yeah.
Think about that. Some of my friends, some of my family members would still be here.
Mm-hmm.
So it's just important that we follow the guidelines and see your way to getting the vaccine.
So Leonard, talk a little bit about that, about the impact that this has had on you personally and others that you know.
I had several family members with COVID. Some passed. I got a friend, a state trooper over in Detroit. He's from here. His name was Jeff Smith. Him and his wife both passed last year in March, April from the COVID vaccine. So it's personal. So
From the virus, from the COVID virus.
From the virus. So, and how many, I'm sure you guys heard of, you got friends in COVID related death. So I don't even know how to say it, but I'm a proponent for the vaccine. I got the vaccine. I got both shots, and it felt, mine's more like a flu shot. It hurt for, I don't know, maybe a day or so. Second time it was a little bit more. My doctor said I was gonna have more pain. He said be prepared to take the next day off, but it was not like that for me. And I had the Pfizer vaccine.
Okay, so you received the second shot.
Yes, I did. February 5th.
Okay. Veronica, how can you speak a little bit about how this has impacted you and those that you are close with or colleagues? I know you are an educator, so this has had a major impact on just the educational system across the board. It feels like it's turned that whole system really upside down. And I think we are going to have a lot of work to do.
Mm-hmm. Absolutely. Yeah. So when I think back to this time last year, I was traveling all over the country. I was in Rhode Island when they announced their first case. I was doing some professional development and coaching with some school districts in Rhode Island. So I had been in New York. I'd been in Rhode Island. I'd been in Cleveland. I was at the basketball game where they played the Utah Jazz when, they talked about, the potential of a spread happening there. And I just remember what things were like in the airport during that time. And, fast forward a few days, maybe a week or so into March, maybe a week or two into the month of March, where I'm pretty sure I had COVID. At that time, we didn't have any way to test that. But what I can say was I had never been that out of breath in my life. I never struggled to just go up and down the steps or anything like that. I've had sinus infections and stuff like that, but this was different. So I'm pretty sure I'd be surprised if I didn't have it at that time. As far as others that I know, I've known several people who have contracted the virus. Some struggled with it a little bit. Others, would have been super spreaders, meaning they had absolutely no symptoms at all, and just continued to just move about. So I'm aware of it's not a direct family member of mine, but the first child that passed away in New York is the cousin of a friend of mine. And that was devastating to know of a 5-year-old have a heart attack as a result of COVID-19. The grandmother also contracted it. She lived, but the 5-year-old did not. So when I think about all those things, I think that it's certainly unique and everybody's experience is different. But just from the few things that I was aware of, it certainly made me very cautious, right? Being quarantined all that time, not being able to visit with your family, wearing a mask to me seems like just something really simple, a simple adjustment to make to save my life or someone else's life for the hope that, at some point in time, I'll be able to spend time with my grandchildren. So, and I studied, I read on my own. I didn't just look at the news. I read articles. I talked to physicians about it and made my own decision to get the vaccine. So I've had both. The first one, I just had a really, my arm was pretty sore. Felt like somebody had bricks on it, much like a flu shot. And the second one for me was a little tougher. I did run a fever. I had just the achy soreness for a few days, but in a sore arm. But again, nothing, it was not nearly as bad as, when you get wiped out with a flu or a virus or something like that. So I've had both vaccines. I did have the Pfizer vaccine. As you said, I work in a school. And so we have throughout the year been from one learning model to the other. We started out as hybrid. Then we went to, so hybrid meaning we had kids in 2 days a week, this group 2 days a week and another group 2 days a week. Then we opened it up so that we had more kids that were in 4 days a week. And as soon as we opened up, I would say within a few weeks, we started getting cases, primarily among staff, more so than students. Although we have had some student cases. So we've had a couple of times when we've had to quarantine the entire school and close it down. But for the most part, again, those staff members came through it okay. So for me, in terms of being able to return to some sort of normalcy, getting schools back open, keeping people employed, for me, it was a no-brainer for me.
Okay. So you would definitely recommend that individuals get vaccinated as quickly as possible.
I would recommend that people do their own due diligence at, doing the research and just looking at it. Again, people will say a lot. There are a lot of conspiracy theories out there, but I think for me, it was important that I not, be out spreading, and then I'm not always just kind of looking over my shoulder. And anytime somebody coughs and thinks that, that they have the virus. So I would certainly recommend that people, do your reading. Don't just look at the news, read the stuff on the CDC, read things about viruses and things like that, and then make your best decision.
Yeah. And I want to say again, just as a disclaimer, the NAACP, we are not, and I'll say from a local branch perspective, we're not, we haven't decided to endorse, folks getting vaccinated. However, we wanted to make sure that we were very intentional in providing information to as many people in Black and Brown communities as possible. So like you said, Veronica, then they can make an informed decision and a choice. And I would strongly also encourage folks to, if you have a relationship with a primary care physician, that you discuss this with your primary care physician as well, because that's critically important. And so they can be on deck if in case, if there is some side effects that are severe, they can be on deck and be prepared and move quickly to be able to help you through those things. And so I see Miss Ellen James has joined us, and thank you for joining us this evening. And
I can hardly hear you.
Can you hear me now? You want to make sure you your computer is turned up? Can you hear? We can hear you. Say something else.
I can hardly hear you at all.
Okay. Can you production? You might want to see if she has work with Miss James to see if she has her volume up all the way on her computer, and see if you guys can work with her. And so we'll come back. So I feel like I'm like right up in the screen, and I don't want to be right up in the screen. And so, and my volume is up. Can everybody else hear me well? Okay. Well, production, you work with Mrs. James, and then we'll see if we can get that volume piece straightened out. So, so Stacy, so you're working with the health department, right? Is that work? Is this a part of that work consist on you being some type of brand ambassador or connector to encourage folks in community to get vaccinated, or what?
So the role, I'm a COVID-19 community connector, and I'm primarily for the African American community. So there's maybe 6 or 7 others who kind of do the same work, but they, represent the different communities, Asian, Hispanic, whatever the case may be. It initially started off as an ambassador to connect resources from the Kent County Health Department with the African American community, of course, as well as share literature, promote, mask wearing, all the safety protocols and things of that nature. And now that we have the vaccine, we are assisting with that work as well. We don't necessarily take stands on whether you should get it or not, but we kind of put the information out there as far as research. And if we have locations that are giving out the vaccine, we kind of promote all those things for those who are interested.
Yeah, I want to say you guys, and we're a partner with the Black Impact Collaborative, and so some great things have been happening out of that collaborative, and just throughout, I think this pandemic period. So you decided, Stacy, to actually get vaccinated as well. And which vaccine have you received?
Yep. So I received both my first and second dose. I received the Moderna, and I got vaccinated through my job at Mayor Feebad.
Okay. So did you grow an extra ear or
Nope.
arm?
All body parts are still the same. But for the first shot, I just had soreness in my arm for about 24 hours, about the soreness in the spot that I, got shot, of course. And then for my second dose, I had a little bit of soreness, but the next day I had a headache on and off throughout the day, as well as fatigue. I felt fatigue.
Okay.
Yeah. I'm normally doing a lot, so I didn't know if that has something to do with it or not, but I believe it was partly just side effects from the vaccine.
Okay. And nothing else. So that was like a day or so, and then it was done.
Yeah, it probably occurred maybe the next day for about 6 or 7 hours.
Okay. So Stacy, how has this impacted you personally in this pandemic and others that you know?
Yeah, so it definitely slowed me down quite a bit. My family, we're always getting together. We're always doing things together. I have a large family, and with the virus and with the virus coming and pandemic, obviously we had to kind of shelter in place and stay away from each other. Also, I'm really very involved in my church, my fraternity, as well as the community. So just a lot of things kind of just went away, So I just kind of felt isolated for a while, definitely. I have lost several family members to the virus, and that was one of the reasons why I decided to get vaccinated when I was able. And also, my department at work, we actually do the COVID testing for Mary Free Bed and outside companies as well. So in my department, we had people coming in pretty much all throughout the day who were, had the potential to be positive. So I just decided to get vaccinated as well because I've seen people walk in who were positive, and I can see people who had the symptoms and things of that nature until I started working from home. So that was really a driving force for me.
Wow. So, Gail, what are your thoughts? How has this impacted you personally or others that you know, and what are your thoughts on vaccination and all of those things?
Well, I'll start out by saying that in the beginning, which was a little over a year ago, I spend most of my time on the east side of the state. I do corporate relocation, so I was there as well as Grand Rapids most of the time there. And in the beginning, Oakland County and Wayne County had thousands and thousands of cases, and Kent County had like 6 or 7. So when I started looking at that statistic, I was scared to go outside.
Wow.
I didn't know what it was, how you get it. All they would say is don't touch anything, wear your gloves, your mask, your goggles, things like that. And so when I started looking at that stat in the beginning of March, and as March went on, it got even crazier, really hit me was I got on the road to travel. And if you've ever been to Detroit, 275, 96, 94, all of those freeways are so busy, bumper to bumper, 4 lanes across. And I could count on one hand how many cars I saw.
Wow.
So that was when the governor did the shutdown. And so then I started looking into it and seeing exactly what it was. And again, it just made me very nervous. And as it elevated, it seemed more of our people, Black and brown people, were the ones that were catching it. It was a problem. It was killing them. They weren't giving the stats on survival. They were giving more stats on death. And so the thought was, if you get it, it's a death wish. And so just continuing on through the year, thinking about that and worrying about that, then it brought me a little closer to when they got the vaccine. And of course, we want to know, how did they get the vaccine? And in my mind, I was like, it sure did happen awful quick. But there are circumstances surrounding them getting the vaccine. And as Ms. Veronica said, you really have to read into it, look it up. I have a lot of friends that work with in the health field. So I'm close to a lot of physicians. So I did a lot of talking to them, and they explained to me different things about the vaccines. At the first, it was the Pfizer, then it was the Moderna, and now the Johnson & Johnson. And so their comfort level with the vaccine and getting it just made them a little more, made them feel a little more safe. Whereas they want you to mask up and they still want you to do everything, but it's like they have a layer of protection. I was scheduled to get the vaccine, but I had a hospital stay. So I was unable to get it before then. So once released, then I'll be back on to get it again. And I am going to get it. And the reason I'm going to get it is because, again, it's just another layer in reading up on everything of protection. I don't intend to go out without my mask or, my glasses or whatever. I'll social distance. I'll still do all of those things. And I will go on to say that even though you get that vaccine, it's still out there. And so this whole opening the city up again has me concerned. I think it's ridiculous. They don't know how that's going to affect everyone, with everyone not getting the vaccine. Now they keep talking about the herd immunity and this and that. Okay, so they do that. But what's wrong with just waiting a little longer to see how this affects people?
Right.
It's what is the herd? I would think that we would still want to be as protective as possible and move ahead cautiously and still, do what we need to do to take care of each other. It's not,
that's a great point. I think and
sometimes a selfish thing, and we just want to get out there. We just want to see our family. We just want to do this and that. And I get it. I do get that. But just a little while longer, we've come this far, is my thought.
Yeah, you make a great point. And then I want to go to Miss James as well. I've been saying to people that we still have to be vigilant, and because here's the reality. The vaccine is not a cure. It is a preventative measure. And so we still have to practice wearing masks, washing our hands, being socially distant to a degree until we really get this pandemic under control. And I think if we continue to add that extra layer of protection on outside of getting the vaccine, that's just going to continue to move us in a positive direction. And I am concerned, I think like many others are concerned, where I believe it's in Texas, where the governor is saying we're going to no more masks, right? And so that's is deeply concerning. And so, again, we have to save ourselves. So we have to save ourselves. We have to do what we need to do and continue to do the work that's necessary in order to really get on the other side of this. And I know this is, some folks feel like this is an inconvenience, but it's not an inconvenience. This is about life and death. And so we have to do what we need to do. And Miss James, I'm going to pull you in to talk about the impact that you've seen personally. And then also, I think you've been vaccinated or plan to get vaccinated. What was your experience like? And then additionally, I think you can speak to a piece of this that is very important, especially when it comes to our elders, right? And that whole social isolation piece, because that's real. We have and I know because I think at one point I was doing quite well, I think, honestly, in terms of not really, that wasn't really bothering me because the movement that I have, I'm out literally 7 days a week, late at night, for oftentimes both the NAACP and then my profession at Blue Cross Blue Shield of Michigan. So this was like a reprieve for me. But then it came to a point where probably about a month and a half ago, I literally just had a breakdown, in a sense, if I can be transparent. And I just felt like I was totally disconnected, even within my own household, with family and friends. And I was just really started to struggle and had to really pull myself back from that, and start to, and I said, I called a friend and he says, Clee, you got to appreciate the fact that it's almost like a little rest right now, right? So you can breathe a little, right? Even though we're still doing the work, but let's just breathe a little. So, Miss James.
Well, first of all, let me say thank you for the opportunity, Clee. I believe I am the elder of the group, and I would be happy to speak as an elder. When the pandemic first started, it was around the last of February, 1st of March, I think, when we became aware of it fully, fully
Right.
aware of it. One of my little sisters by choice, I have sisters by choice, she fell and broke her, just a freak accident, and fell in her home and broke her ankle and her knee. So she went through rehab, went to the hospital, had surgery, went through rehab. And I was trying to set up, because I knew it was going to be very difficult for her and, her family. So I was trying to set up a 24-hour kind of stay between us and some other friends. Well, as it turned out, the day that she came home, it was a couple days after they shut down. Well, the day that she went home from rehabilitation, I went home with her. So I spent over 3 months at her house with her family. And so it wasn't like, I was like by myself. But I listened to the news, and the ladies were talking about, doing the research. I did do some reading, but a lot of my information came from the news, and became very frightened. Did not understand exactly what it was and how it was going to affect me. The thing that struck me really hard was it was about more Black people were catching it than other people. So that was very, very alarming for me. Um, I guess I'd have to say that I always intended, once they said that there was some type of cure um, to the COVID, I had always decided that I was going to take it. I mean, there was never a hesitation in my mind of whether I was going to take it or not. If they had something out there that was going to cure it or help with it, then I was going to do it. Um, I'm one of these people that I take a flu shot every year. Some years I get the flu, and some years I don't get the flu. But when the shingle shots came about, I went and took, well, I waited for years and years. I didn't do it because my doctor, he just felt that he didn't particularly believe in it. And I had never had chicken pox. So I guess that was supposedly that was a key, but I'd never had chicken pox. So I never took it. And then I had some friends who were just really having a heck of a time. So I went and took those 2 shingle shots. Um, I'm not afraid of taking shots. And so, like I said, it was always my belief. And once there was something out there that I was going to be a part of it. We've had over 500,000 people. I'm not sure what the number is today, have died. And it hasn't just been Black people. You know what I'm saying? In a lot of areas, Black people have been affected because uh, of the conditions. You know, like one of the things that I'm kind of getting off here a little, Clee, but you know, I called you and I said, Clee, because there was nothing that was happening in our own community. And
Correct.
I was just lighting you up and everybody else up, and you know, trying to figure out what we could do to make sure that we were getting some of the vaccinations in our community. And you know, I stayed on you, and you said, Miss James, we're working on it. We're doing this, and we're doing that. And so once I found out that it was coming into our neighborhoods, then I felt a lot better. I really truly felt a lot better now about it. I've had both of the COVID shots. Um, the first one was just really a breeze. The second one was really a breeze. When I was at the facility taking the second shot, the staff came around and they were talking to us, and they said, you know, move your arm, because your arm is going to be very, very sore. And so I'm sitting there waiting the 15 minutes, just flapping my arm and flapping my arm and flapping my arm. And so my arm was a little sore. Because when I get the flu shot, my arm is sore. And it was about to that extent that my arm was sore, but I was not sick. I didn't have any effects from it. So I feel good about it. I will continue to wear my mask. I will continue to do the things that I'm doing right now. I'm not going to let up in terms of what I'm doing, because I don't know what other people are doing. I'm still doing stuff. I run to the store. Um, I have a couple friends. I can go to their house because I know where they've been and where they go. But I'm very careful, and I'm very careful because I am at risk. I have an existing. I probably have more than one, but I do have an existing condition, and I want to go to heaven when I die, but I'm not ready to go today, kind of thing. So I have been good with it. I'm comfortable. I'm reading more about it and finding out more information. So I would just, I haven't pressured any of my friends or family to take the COVID. But what I have been doing is just calling and giving information in terms of, this is the number that you can call to make an appointment. And if they say no, I said, okay, then, fine. But it is truly my wish that as many people as possible will take it, because I think it's something that it is going to be helpful. Uh, Not just to me, but to an awful lot of people. And I will say that I'm starting to feel more comfortable because people are coming into the community where a large number of people of color are. And that, to me, that is very, very important, that we get equal treatment while we're going through this process.
Right, right. I will say, I know Stacy, New Hope has been hosting some vaccination clinics, and
Right.
also there is a vaccination clinic down at the DeVos place. And I don't know if any one of you know if New Hope is, when is the next vaccination clinic for New Hope? Does anybody know or is aware of that?
Yeah, so it's one happening tomorrow. I think they're doing
Tomorrow.
I think they're doing maybe 600. I don't know when they're planning to do more. I'll definitely find out for sure though.
So I guess my question is this, and it's probably better suited to I don't know, Stacy, maybe you can answer this, but I could talk to Pastor Earl, who's a senior pastor at New Hope. Where is this information being shared? That's been my biggest issue with this. I haven't seen a flyer.
Mhm.
I haven't seen anything published about this clinic, and maybe I'm just missing. But I do know, and I talked to Pastor Earl about that earlier, because when we found out, he had reached out and asked for us to share information through our networks. And I'd asked about a promotional flyer or something, because, those people, again, if you have individuals who actually want to get this, they have to know.
Right.
And so I don't know, is there some type of a communication or flyer that's out there?
Yeah. So initially it started through the work I was doing as a COVID-19 community connector. So I'm at the table up with the health department with all these different things. So we're actually looking for a site to host a 65 and older vaccine clinic. So I'm like, let me ask my church, right? I think that'd be a good site. So I started there. The first couple of times we did it, we definitely had flyers out there. And right now it's really led by Spectrum Health. So New Hope, is just the site. The site was chosen to really, focus on the African American community as well. But I definitely took a note down to kind of get the word out a little bit more, because they kind of promote them really fast and they fill up really fast. So it's really a fast-paced system that they have going. But yeah, New Hope really just serves as the site. So most of it comes through Spectrum Health, who's doing the vaccinations.
Okay.
The
So,
way I found out, Flea, was it was a robocall from my church,
mhm.
and I think it was during an executive board meeting that I got the information, and I got up and stepped away from our meeting to call in. I've been doing it by word of mouth. I have the numbers, and I really have just been doing it by word of mouth. But I have not seen, you're right, I have not seen any posters or anything like that.
Yeah, we have to be intentional, and I think it's critically important, because I'm just going to say this. Black people and brown people, or I should say other people in communities of color, we're very visual, right? And so we have to be intentional in terms of how we're marketing. And I say that because, oftentimes information when it comes to Black and brown communities, we receive it at the 23rd hour.
Mm-hmm.
And then everything's over, or it's too late to do anything. And we just have to be very intentional with that, because especially when you hear folks saying that the Black individuals in the Black community and brown community are hesitant. Well, are they really hesitant, or is it just that the information is not getting down to them in an effective manner, right? So they can actually show up. And so we just have to be really, really, really intentional in terms of how we communicate information to communities of color. And we cannot wait until the 23rd hour to put this information out. So I would say, I think people can still register, right, Stacy, for the New Hope Clinic?
Yes, they can. I got to find the number for you. But another interesting fact regarding the vaccines themselves. So they come in, from the state, of course. They get to the county. And the county medical director, she really decides what location, what vaccination site gets how much vaccines. So
Correct.
really, people they're not able to plan really too far ahead because they get, let's say if they tell New Hope or Spectrum, we're going to give you 500 this week to do it, then it has to go like that. So it's really, really fast. I still that doesn't take away from the fact of getting flyers and things out there to be visual, but that's just another interesting fact that it really does move really fast depending on what allotment different places get.
Yeah, and I can speak to that a little too. I've heard that typically they have about a week's leeway time. I heard that, but that supposedly is going to get better, and they're looking at least maybe 2 weeks. But even if they're notifying the site in a week, right? You would think now that there should be templates of promotional materials already developed, and the only thing you have to do is plug and play the date, et cetera, et cetera, et cetera. And so it's just, I don't want to belabor that, but I think we just have to, the powers to be have to do a better job, and we have to challenge them to do a better job when it comes to things like this. I've been on a team, a leadership team, to help in partnership with the efforts that Meyer is doing across the state. They're hosting a number of clinics at their stores with Blue Cross Blue Shield. This is the first one that we're rolling out in Berrien County. And their target audience, because they've been filling up. I mean, they have a waiting list. People are traveling from out of town to get but their target audience is Black people and brown people, and it's not happening. And so I've been put in charge of, okay, how do we effectively and intentionally outreach? So I actually had to be on the ground there one day this week, spent all day meeting with community partners, several partners that we worked with for years that I know that they have the acumen, I'll say the grassroots acumen to reach out to people. And so the first thing that I said, we have to have a promotional flyer, period. And so we've had people on the ground putting flyers in gas stations, and we've gone into housing complexes, community centers, and we're working with the Community Action Agency and Meals on Wheels. They're actually been distributing flyers through their meal delivery service. And so I did an interview with the Herald Palladium while I was down there talking about this effort that'll take place on Monday. And then we'll do an interview on the radio station at 8:00 in the morning to talk about it as well. So it's just, and I knew those things had to be done just from my experience and things that people were saying, like what Ms. James said earlier, why isn't this coming to our community, right? And so again, I don't know if it was not coming, but I don't know if the information was being pushed down to let people know that it was here and where actually is a site and what's available. So
if I can add to what you were just saying. So I think that information is getting out. I think there's a gap in the way that the information goes out. So when the information goes out, really, we need to be encouraging people to sign up early. Instead of waiting for someone to contact them. It's almost like a lot of people are thinking someone's going to contact you and say that the vaccine is going to be available at X place at X time. And typically you're not able to just show up at X place at X time. You've got to pre-register. Pre-registering requires that you go online and fill out some information or open an app and put your information in there. So it really depends so the person has to, one, have reliable access to technology, and then two, really know how to use it in order to get their names and things in there. And then when you get in there, you just really like the first time you register, it is whether it's through the Spectrum app or whatever, you register and then that's it. And you sit and you wait. And so that part I don't think people are really clear about and aware of. And then when vaccine becomes available, you'll get a text message or an email. And at that time, you go in and you finish the registration and you choose a location and then you choose a date and time. So I think that there are gaps in information. I think people really need to see systematically the step-by-step process that you have to go through in order to register for it, make the appointment for it, get there. So there may be people in our community who really need assistance doing that part of it.
That is correct. And I will say this, that's what we're doing in Berrien County. We're working with Abundant Life Ministries and Marletta Seats and Pastor Dwayne Seats, who's her son. And they are actually, a part of their role is to assist people who are not tech savvy, or there are folks who can't get a text message. So they're assisting with that part and making sure that they have people that are authorized for certain seniors, and these are for the shots on Berrien County is 65 and older. And actually, let me correct that. We just decided, I think it was today, to take 50-year and older, but 50 years old, you have to have a pre-existing condition. And so in our target, there's a target zip code 49022, which is the city of Ben Harbor proper. And it does cover some of Ben Harbor Township. Or Ben Township. But those are the things that you have to do. And then we've also set up a transportation system. So people actually need rides. And so Abundant Life Ministry is coordinating folks who need rides as well. But I want to get President Fields, Jayvon, in here to kind of talk and speak to the youth. I'll get right back to you, Gail. Hold on for 1 second.
Okay.
To speak to the youth voice, what are you hearing out in with your peers or among your peers?
Yeah, so when it comes to the COVID vaccine, I've had a lot of conversation with people, my age, and a lot of us have said we're not going to take the vaccine just because we're not too knowledgeable about it. And it also seems kind of suspicious that it's been ready to go in less than a year. However, a lot of young people have not taken the flu vaccine for a number of years. So if they're not taking the flu vaccine, then they're most likely not going to take the COVID vaccine. And so, I mean, this pandemic, though, has been a large strain on a lot of young people. We're forced to be inside the house. We're not able to enjoy the same luxuries as we had before. And we're itching to get outside, but we're also, not too comfortable with taking the vaccine that hasn't really shown much results. It seems like the people taking it right now, I'm gonna speak honestly, this is kind of the youth thought. The people taking the vaccine right now, kind of like test dummies. We just trying to see how it's gonna turn out for y'all. Will you get a tail? Will you get an extra ear? And if you don't, okay, maybe I'll take it. If you do, then, but all just aside though, we just trying to be cautious and make sure we're making the right decision, thinking long term and things like that. A lot of young people haven't really seen their peers get COVID. And also hearing the news too, that if you're young, you're less likely to get COVID. If you do get COVID, you can recover. And with that in our ear, being able to recover, it's kind of like, well, why take the vaccine if I can recover because I'm young? And that's kind of our general thoughts about COVID-19 and the vaccine. And yeah.
Well, let me say this, President Fields, and I want to be really, really clear. You had a front row seat in the death and burial of Honesty Hodges. Honesty was one of our youth. She was like family. And she was 16 years old. And that virus ravaged, I should say, her body. And I know what it did, to her, because I was in constant contact while she was, going through her last days of her life. And so to hear what it did to her is devastating. And so I think with respect to maybe young folks not having enough information, that's why we're doing this, right? And so this is part 7. So I would encourage you to invite all of your peers to go back and look at all of these live streams, because there's been a wealth of information, right? A wealth of information, not only just on the vaccine, in the development of the vaccine, but just COVID in general, and being precautious or making sure you are vigilant and cautious about your movement and how you're moving. And so I would just say, don't ever fall for the okie doke, young folks, young youth and young adults, that you're just totally immune and nothing will happen to you.
Well,
and so I would just say, just be very cautious and still do everything that you need to do. Leonard?
I've done everything I could.
Let me say this too.
Let me say something real quick though about the youth perspective. And so, when we saw Honesty Hodges, go through a situation with COVID-19, me personally, I was like, okay, let me get in the house. Let me make sure I do whatever I can to stay protected. But I think what's happening with a lot of young people is not really hitting us as hard as it should be. We're more focused on trying to live our life, trying to get back on campus, trying to go hang out and things like that. We're just waiting for this COVID thing to blow over, and we're not really seeing or hearing about a lot of our peers going through COVID-19. And so since we're not seeing that, we're thinking that it's not that big of a deal for us young people. But I think what we should do, and I'll take the lead on this, is trying to showcase the young people who have gone through COVID-19. I think the news doesn't really paint that picture. They don't really tell that narrative of how young people have suffered from this horrible disease. But we push it out there so they can see what's going on, rather than telling them information. The information is there, right? It's accessible, but actually seeing and hearing what's happening really, make us hone in on the importance of being safe and being cautious as we continue to be out here in these streets.
Yeah, that's a good point.
Can
I say something?
I had a question. I just wanted to go back to, if I could, Cleve, when you were speaking of the clinics and going in and getting in Van Buren and that with Meyer and Blue Cross Blue Shield. My question is, who is it that decides what vaccine each site gets? Who decides that?
So let me think about it. I think that really is based on what's available. It really is based on what's available. And so actually, the site doesn't really know what vaccine that they'll be getting. They just, they'll whatever's available, they send it to them. Now, I do know, and I'm not sure how this happens, but I do know that the vaccine that will be administered on March 8th at the Meyer store in Ben Harbor is the Pfizer vaccine. So I do know that, but typically I don't think the site really knows. It's based on what's available.
Okay.
Yeah. Yeah, Leonard.
Let me just want to say this to Jayvon. You know, it doesn't affect you, but what about Big Mama, Big Papa? You know, your grandparents are the ones dying from this. You guys go out and do your thing, not get vaccinated, and then you come home and you bring it to them. They get sick, they die, and then you guys wonder about how come you can't go to the funeral, you know, because of the pandemic, you know. So you guys got to think beyond, you know, it's a village. You got to think beyond just yourselves.
Yeah, that's
Yep.
a good point. That's actually a good point. Because my grandmother, she was very concerned about the COVID-19 and things like that. I was actually living with her for a few months into the pandemic, and then I found an opportunity to move out and get a place of my own. Doing that strategically so I can make sure that she's in the best safe space. Because I was still having to work and go outside and things like that. And I was cautious about, okay, well, I'm still out here working. I can't come back home and bring some to my grandmother. So I did take that step intentionally to make sure she's in the safest position. But that's a good point, though. We do got to think about, our family and our elder relatives who are more vulnerable to this COVID-19. But the thing is, too, is that we got to think about ourselves and try to really think about how we can be vulnerable as well. We've seen how Auntie Hanges and a couple other young people have suffered from COVID-19. And that right there, if your family members, if you only consider your family members, seeing like your peers that's your age should make you say, okay, well, let me stay in the house too. But we really got really present that to the youth face that this is a serious situation.
Yeah, I want to say this, Jayvon. Also, I'm gonna back up a little bit, and I want to say that I want to be clear that hopefully I'm not coming off. I'll just speak for myself or others that I'm not coming off as being judgmental. What I say is out of love, and so I don't want to come off as being judgmental because, and I thank you for your transparency, quite honestly, because the question was to you is we wanted you to give us the down and dirty on the youth perspective, and you're being very honest. And so I want to say if I appeared to be judgmental, viewing audience in any way, I apologize for that, and I just appreciate your honesty. And then one of the things I will say though too is, again, that's why information is power, and so we have to put as much information out there as possible. So again, I invite folks to go back and look at these live streams. I was put in charge of leading a work stream at Blue Cross to develop actually a vaccine resource guide. That has been completed. We will put that on our NAACP website, and then we'll be sharing that just throughout community. And a ton of information went into developing that resource guide. And it's all based on peer review information, well-researched information, and different things like that. And it's a quick read. It's several different topics. It's not we wanted to be kind of clear, simple and quick. And so we'll be pushing that out, and we'll put that up, and we'll try to get that on our website within the next couple of days. And so you can always access that as well. And we will continue these live streams. But I want to just go to real quick as we are wrapping up some of the comments and questions from our viewers. And I want to thank Miss Veronica Williams. She said, again, I appreciate the NAACP Grand Rapids effort to educate, encourage, and inform the community on COVID health, information, resources, and engagement. Appreciate you all. And then Rhonda Libet says, real talk. Ms. Veronica Williams says, correct, masks are very protective measures to avoid not only contracting COVID, but, you know, other things like the flu and other infections. And Rhonda Libet said, did you say 55 or 65? I think she was referring, Stacy, to the vaccination clinic at New Hope. I believe that's still 65, right?
It is 65.
It's still 65. And I'll say this as well, for those of you who have family members and friends in specifically Ben Harbor, 495-022 zip code, and also in Niles, in Dowagiac. If you know folks, please share the information with them about the vaccine, the vaccination clinic that will be held at Meyer on March 8th, and which will be the first shot, and then the second shot will be March the 29th, and it's at the Meyer on Pipestone. And so they can contact Meyer for additional information, and or they can contact Blue Cross Blue Shield of Michigan for additional information, or the NAACP at info@naacpgr.com, and we'll get that information. Ms. Veronica Williams again said she's been pushing for health education and health information. She participates on a weekly call with the King County Health Department. And so she wants to talk a little bit more about that. This is from Sandy Willis, and I think this is for Stacy. Stacy, are the people that you see coming to the site expressing their past fears as well in getting the shots? And I've only heard of New Hope being a site, but the info comes through the seniors in the area.
Yeah, so people definitely are expressing their feelings. You know, some people come, they're nervous, they're scared. Some of them, you know, some people still actually feel as if there been a test done yet. President Fields kind of mentioned earlier, but you know, obviously they've been assured that this is safe. I believe they're making the right decision. They believe they're making the right decision, and that's why they're coming. You know, they're doing this to save themselves and help save lives, additional lives as well, and just kind of giving that extra protective measure to kind of end this pandemic.
Mm-hmm.
As far as the site, you know, we definitely have work to do as far as pushing information regarding all the sites that come available for the vaccine. As I mentioned, I know it kind of goes really fast, but yeah, I have a bunch of notes regarding kind of.
You just did something, Stacy, to your volume, and you turned it up. That was really good. Somebody had made in the comment section that Stacy's volume is really low. So
I don't know what I just did.
I don't know what you did, but you kicked it up a lot. You know, I have another comment that media has been intentional. This is what one of the viewers is saying, that they believe media has been intentional on not reviewing youth deaths. So has the governor's office. This supports the desensitization. It's getting late, and they feel. I think she's talking about the youth. They've been desensitized. That they feel about COVID. And this viewer says that they personally agree with their caution, with the youth caution about getting the vaccine. Ms. Veronica Williams says, if and when people get information and not answers regarding COVID and vaccine pros, they will sign up. Ms. Lake is on it. The wrong folk are being charged to getting the word out. I've suggested billboards, paid media, etc. Let's talk.
Be very intentional. Yeah.
Yeah, very intentional.
And to go back to the youth, you're right about that. You don't see a lot when it comes to the youth, when it comes to the news and them reporting it and this and that. Because if you look at it from what they report, you would think that the youth don't get it, but that's not true. They do get it, and it's not being reported as much as it is for the Black and brown people and that are adults and over certain ages, but they get it and they pass it as well. So that's
Well, yeah,
important information to get out.
you're right, and that's not being reported. I know another case, and this was through a client of ours that her son contracted, and I think he was 16 and he died as well.
Right.
But sometimes we don't hear about those things because
Right.
it's not. In honesty, just because of who her story, who she was, that just made, again, local and national news. And then people started to talk about the impact of youth. This is interesting too. I've heard a lot about this. Vivian Jackson says, I've heard people from other communities, not people of color, registering in everyone's area in order to get the shot. Is that taken from the target area, which it was intended? I would absolutely, yes, it's taken from the targeted audience. But again, it has to be intentional. And we have to partner with partners who are intentional. And so one of the things that we are doing in Berrien County with this clinic is there was a separate keyword specifically for people of color to use. And so to text, and then those individuals would be identified and ensure to get a spot, a registration spot. And I will say it's not everybody's welcome to sign up, but again, we know that people are showing up and that have the means and the technology and everything else in other areas to get the vaccination. I'm seeing if we have any others. So Daryl Fisher, really appreciate the honesty and sharing of personal experiences and views and the respect for different perspectives.
Okay. I can say something to our young brother, Jayvon. I really appreciate him sharing the thoughts that you have. I think it's really important. I also would like to encourage him and any of the friends that he speaks to, again, don't just look at what's on social media, not just what's on the news. All of those streams of communication are done to, it's the hype all the time, right? Like, what's the worst story we can tell or the greatest story that we can tell? Do the research. Again, when we think about how quickly the vaccine was created, and again, we have those same conversations among mid-age, older adults. Why was it so fast? When you throw $1 billion at a problem, you will get a solution, and quickly, because you have the money now to pay all of the top researchers in the country. One of those top researchers on the coronavirus was a Black female. She's out of North Carolina, I believe, Chapel Hill area. So they were able to find the top virologists in the nation to begin working on this because they had the money to pay it, and they didn't have to jump through all of the government regulation hoops that they typically would have to jump through to have a vaccine out there, have it tested, and all of that. So your generation of people being involved in knowing a little bit more about how the process works, what viruses really are, how viruses themselves are, like they say, if we had an atomic bomb, that roaches would be the last thing to survive. That they would still be here when everybody else was gone. Viruses are very similar to that. They recreate themselves. They find a way to survive. They have a personality. And so that's interesting. And so people in your age group really start to look at some of those things, because when these kinds of things happen again, and it'll happen again, this is the first of this type with the respiratory, where it's just wiping people out, their respiratory system. But these variants are doing just that. They've got their own personality, wipe people out. So really, your generation of people will be the next generation who comes up with vaccines or come up with ways to get through the next thing. So I appreciate you guys being don't be over trusting. Check it out and believe it, sit on it, take that energy and put it into knowing a little bit more about it.
And two, like Cleve was saying, Jayvon, look at the past live streams we've done, because we've had physicians and things of that nature on, different people from different walks that deal with that vaccine and the origins, and they tell you. So they go in very depth information on it when you pull them up. So she is absolutely right. Be sure you check into that information yourself.
And they also, a lot of people don't know the coronavirus has been around for a long time. They just didn't start working on this vaccine. People say they made it too soon. They've been working on this overseas and probably even here. So the virus has been around. We just have to get lucky to get one that works so well.
Yeah, I want to say Georgine Bello said and she says, in my neighborhood, Baxter, I've seen a lot of masks, even when we come out to help folks get cars unstuck from snow. And she said it's very reassuring. And thanks for the information on vaccines. She also asked, should elders who have had COVID get vaccinated? I believe the guidelines, if you've had COVID, if you've tested positive for COVID, I want to say if certain, you can correct me if I'm wrong, but I think they said 90 days.
That's what I heard.
Yeah, so it's that's what it is then. It's a 90-day waiting period.
Oh.
Yeah. Okay. 90-day waiting period. So they can get that. They can still get it. And the other, is there, Newt Sky, we have a viewer, is there any information on COVID vaccines and breastfeeding? We will see if we can find some information on that and make sure we put that out publicly. President Fields, Jayvon, you have received a number of affirmations and high fives. Affirmations and high fives, brother. People are really thankful for your voice in this conversation tonight.
Just keeping it real, speaking the truth.
Hey, I've taught you well then. So, yeah, 90-day wait, that is correct. So I want to thank everybody for coming on. I want to thank all of our viewers for watching. And we're going to continue this series. We made a commitment to continue it as long as we need to, and so we are committed to that. And also, just for the viewers and our guests tonight, these live streams can be viewed again and again and again on our Facebook. NAACPGR Facebook page and as well as the NAACPGR YouTube page. This is being live streamed tonight through both of those social platforms as well. And again, if you have any other questions or comments, suggestions, feel free to reach out to us. You can send us an email at info@naacpgr.com. You can contact the office as well at 616-719-3478. And I will give Ms. James the last closing comment if you have a closing comment, Ms. James, that you wanna say.
Is she there?
She's there. She just She might have received a call or something. So, yeah, she must have received the call. So I will do the last comment. So again, thank everybody for joining. Thank this awesome panel of guests tonight. And as always, thank you all for, just as we say, for keeping it 100. And I want to encourage everyone to stay safe and be vigilant and in what you do, and enjoy the rest of your evening.
Go blue, go green.
Thank you so much. Thank you so much.
Everyone, thank you.
Thanks, everybody.
Take care.
Thanks.
All right.